Hey everyone.
You're fine.
So I'm Becca,
I'm Erica.
and today we're going to be talking about needle exchange programs. I am against needle exchange programs,
And I am for them.
and this will be our introductory statement round.
So, a little bit of a background on needle exchange programs. They are programs that provide access to sterile needles and syringes for people who use drugs, and it also provides a safe space to dispose of them. And they also offer services such as screening, different mental health programs, wound services, and other aspects that can get people help.
Yeah, so today we're just going to hit on some of the high points that we found for each of our sides of the debate. Yeah.
First one is 4 minutes. Okay, I'll go first. I'll go first. Okay. So, as a reminder, I'm for needle exchange programs. So, the CDC really says a lot about needle exchange programs. Like I said, kind of in the introduction, they offer a safe place for people to dispose of their needles. And they provide information such as programs, referrals, screenings, education, vaccination, and wound care for needle drug users. Evidence also shows that needle exchange programs can be effective in reducing risk factors such as wounds and diseases being spread throughout the community of people who are injecting drugs by 52% in comparison to those individuals who do not utilize those programs. And that is a reference from Swan. I'm so sorry, I don't know how to say that. Needle exchange programs are, honestly, they're just creating safe places in our community that people can go to and to seek refuge on how to get new supplies, help, and a variety of other services listed above. So there's a really big stigma, and it often tends to be a negative stigma surrounding needle exchange programs, and they saying that they can be detrimental to people and prevent them from actually getting treatment help. So this stigma can often prevent these people from utilizing the services that it provides due to fear of judgment. Research shows that there is significant value in helping these individuals suffering from substance abuse to use social support, and these programs can provide different social supports such as peer support groups, mental health programs, coping skills and strategies, and other things along those lines to those individuals, whether it be resources or through community help. Decreasing the stigma can help others come forward and be more open about their addiction and drug use. This can, like I said earlier, really create a safe space for the community to come and help and just be a welcoming area for people. And then, like I said, they can also seek treatment with these people through peer support groups and things like that. There's also research that shows people that are utilizing these program services are often on the road to recovery. In a study, researchers found that 78%, I'm so sorry, 78% of their users showed interest in reducing to stopping their use of heroin altogether. It is evident that these programs are working in favor of reducing needle drug use throughout the communities. And increasing the amount of them can have a significant impact on reducing drug rates. These services also take a harm reduction approach by providing people with clean syringes for IV drug use. It helps to reduce the risk of HIV and HCV. So overall, these programs can not only help to reduce IV drug use, but also reduce the general stigma surrounding it. So people feel more safe coming to get the services that they deserve.
Perfect.
Thank you.
We're going to take a little bit of a break between the next. I was trying so hard.
I'm sorry. I am so sorry.
I have tears in my eyes.
I am so sorry. Okay.
Wait, we're still in round one, because I still gotta do my part.
You're right. Okay. Oh, God.
You actually hit it right almost.
So it's like 30.
Yeah. I'll worry that mine is going to be. I'm going to have to
I'm not.
summarize. What? Yeah.
I'm so sorry.
We're going to be sick.
Okay.
I was so scared that when I was drinking my water bottle that you were going to say something that I was going to spit on you.
Okay.
Okay.
Whenever you're ready. You can. I'll make it.
I get 3 minutes, right? 4. Okay.
Whenever you're ready.
I think I'll just go for it.
Okay. Right.
All right. So, while needle exchange programs have been implemented with the intention to reduce the risk of infection of bloodborne pathogens while decreasing drug use and health risk to the general public, there's just some logistics that I found in my research that could be an issue with implementing these programs. So while these are well intentioned and I think that they could be necessary and they are necessary, I think that there are some areas that we need to look into to further develop them to be successful, effective, and sustainable. So, some of the research that I found is a lot of the studies that support the benefits of needle exchange programs have a high selection bias. So, studies that are utilized that have a high selection bias that reduces their credibility of the evidence that they found. So I thought that was interesting, and a lot of the research that I came across that was an issue. And so in Swangjit et al., they conducted a systematic review and meta-analysis of needle exchange programs in primary care settings. So the purpose of this study was to determine if pharmacy-based needle exchange programs or other health centers had better outcomes of needle exchange programs. So the results of this, it appears to be effective in reducing risk behaviors among people who inject drugs, but their effect on HIV, HCV prevalence, and economic outcomes is unclear. So all of the studies that were included in this systematic review had a serious risk of bias. So the study specifically focuses on primary care settings. While it's not conclusive of all the programs, this is still something that we should definitely consider, is that the evidence that we do have available, there are a lot of serious risk of bias in those studies. So another study that I found was Fernandez et al. They conducted a systematic review over the effectiveness of these programs. A lot of studies in their research as well demonstrated high selection bias. So it wasn't just one research study I found, it was multiple that demonstrated a high selection bias of the evidence. So I think that in order for these programs to be sustainable and credible, to their effectiveness, that more established research needs to be done. They also, needle exchange programs, they also offer additional services for clients, but it's only a recommendation, it's not required. So people who utilize these, they can be provided the sterile syringes and equipment, but they don't actually have to utilize the services. So really this could be a downfall for the taxpayer money that's being allocated for the resources. Not only for the company in general, but also the people who are paying into taxes. They could be losing out on money because people don't have to actually use the services that are provided. Needle exchange programs itself are not, the funding for it actually can't go towards the needles itself. It's actually just towards the rehabilitative services. So again, that's just another additional concern that is available with implementing these programs. So yeah. Yikes.
You're fine.
I don't even think I got you.
You didn't laugh like I did.
I almost did, girl.
I
was getting choked up.
I was trying not to laugh.
I was getting choked up, girl. Alright, so we're on round 2, right?
Yeah. You gotta give me a minute though.
You're okay. I don't even think I don't know if I did all my answers. Well. that song that I remember.
Oh.
I started.
No.
Oh, goodness. Still recording?
Yeah. 10:22.
Is this thing on?
Hey.
Hey.
Okay. How much was this one? 30 minutes?
Yep.
Okay. Is that right? Oh, yeah.
Mm-hmm.
Okay, hang on. Let me think. So one of the really big benefits of needle exchange programs is their effectiveness, in reducing the prevalence of HIV and HCV within the community. And Platt and others in a research study conducted in 2018 found that it could be reduced by 74%. And then, in the same research study, they also concluded that high needle exchange programs cover significantly high needle exchange program coverage significantly reduced HCV attainment. So I really think that is like a really big driving force behind needle exchange points, as HIV is so prevalent in our communities. So then I also want to talk about the needle exchange programs. Oftentimes they're a gateway to initial screenings and tests for HIV for people who inject drugs. And because early detection is key for HIV, a needle exchange program may be their first step into getting the help that they need for this. They can start receiving treatment earlier and therefore decreasing the chance of spreading it to others through needles and other activities. Building and establish trust with these reoccurring patients who come to these can really help sway their decision to be tested for HIV, which is also why it would be a great idea to have them implemented into more communities. So then I also want to touch on the fact that going to a medical professional while being a person who uses drugs can often be really intimidating. So seeking out services through a needle exchange program can often create a safe place for these individuals to come back to seek help. So, and while these extra services that they offer are only a recommendation, if the employees who spend their time at the needle exchange program take the time to build a rapport with these clients that keep coming back, they might have an increased chance of utilizing these services. I also want to bring up the point that needle exchange programs really help to promote positive relationships with law enforcement. In a research study completed in 2021, Franco and others completed a qualitative needs assessment of needle exchange programs. They found that a significant number of staff mentioned their positive relationships with local law enforcement. They concluded that the main factors that facilitate a high-quality relationship is the support they get from leaders in law, offices, participation in law enforcement assisted diversion program, which is the LEAD program, and they provide management for low-level drug offenders, and the implementation of the needle stick prevention law. So having this positive relationship with local law enforcement makes a more cohesive community. Therefore, people who inject drugs, a lot of times they might not trust these officers, but if they have a good rapport, it can oftentimes make the transition and these conversations to have with them easier. So, thank you. Okay. Whenever you're ready, we can start it. But take your time.
Yes, ma'am.
I have something in my throat.
think I'm ready.
I was going to make it big. You don't have to start that. Okay, you can go whenever you're ready.
All right, you can start. Okay, so some points to kind of rebuttal the things that we've gone over. One of the key issues that with needle exchange programs that I found is sustainability. So where there is research to support the harm reduction approach of needle exchange programs, there's still a risk for closure of these clinics due to the absence of literature supporting their sustainability. So as I talked about before, the high risk bias in literature studies is a barrier to getting support for these. Funding is supplied for these programs through public health agencies, political media, and community campaigns. So, further evidence in order to get the buy in from various agencies to fund these clinics is needed to solidify this harm reduction approach and prove that it would be sustainable and effective across context. Another thing that I found is that stigma. So it can, while the purpose of needle exchange programs is to reduce the stigma, there's still a lot of stigma that exists between and within communities. It's still widely present and pervasive, and so these values in society have more so been geared toward drug misuse rather than safely using drugs. So I think a lot of community education will be needed in order for this to be successful and sustainable. A lot of people might not be aware of what a harm reduction approach is, or understand why we're giving people who actively use drugs sterile syringes to continue to do that behavior. So maybe just more education about what that approach looks like, and specifically within communities and across. Especially different areas might have different values depending on like what area of the country you live in. So it would be important to assess that specific community and what they believe in to really get that community buy-in, because that funding does come from community taxpayers and all those things. So really just the logistics is still a concern that need to be worked out in order for society to accept these programs and sustain them and continue to put funding into them. Cool. Well,
this one's 3 minutes too. Oh yeah, I forgot about those.
And then this is the last one.
Yeah. There we go. Alright, give me a couple of seconds. Yeah. Do we have to say anything special for that?
I don't
think so either.
No, just response and final position.
Okay. Alright. 3 minutes. What happened?
I thought I turned it off.
Okay. Ready?
Yep.
Okay. So I want to touch on one of your opening points about them being about needle exchange programs not being sustainable. And I agree with you that there's limited research on this, but there are a number of ways that have been researched in order to keep them sustainable. The Center for Disease Control and Prevention, the CDC, created it's called a Syringe Service Programs, a technical package of effective strategies and approaches for planning, design, and implementation. This booklet explains how funding can be made simpler for these programs to stay afloat and sustain. So the authors, Javed and others, concluded that partnerships with health agencies, community-based organizations, and other state officials are most important to this in the sustainability of these needle exchange programs. So really all that's saying is you have to start off on the right foot with them. So coming in contact with all of these community-based supports, other health agencies, and state officials can really help create kind of a network of resources that can keep the needle exchange program successful for years to come. Another research studies showed that coalitions, so those relationships you have with people in the community, and community consultation are critical for both the acceptance and sustainability of needle exchange programs. And this was a research study completed by Downing and others. This research does tell us it's possible to be sustainable if they start right from the beginning. So they have to really come out on the right foot to get going. This can also be used as like a marketing technique for politicians and community companies and others. If people see that they are in support and they are involved in the sustainability of these programs, it brings more attention to the importance of these programs as well. I also want to talk about stigma. So people who have an addiction are oftentimes viewed negatively. And while needle exchange programs aren't necessarily stopping their drug use, it is aiding in providing education and safe needles for them to use, which helps the overall community. And in a research study completed by Trey Lohr and others, they found that needle exchange programs the employees there often have to discredit the perceptions that other people believe to be true about these programs. So while people people who use drugs often have complex and deep emotions towards their addiction and recovery. And because these people already face so much stigma as it is, having strong and educated employees can help to reduce the stigma both away and at from the clinic. So, yes, that's all I had. There we go. Can I see those papers real quick? Mm-hmm. Sure, something. Ready.
All right, so to kind of summarize what I've talked about today from the opposing side, so the intended outcomes of needle exchange programs are to decrease drug use, prevent transmission of bloodborne pathogens, and decrease health risk among the general public. So while these programs are well intentioned, there are gaps in the evidence and logistics that need to be considered in order for them to be sustainable and contribute to the outcomes intended. So in summary, some of the important points that I've made today regarding needle exchange programs are the high selection bias in the systematic reviews that have been conducted about the effectiveness of these programs. So there needs to be more substantial, concrete, and credible evidence in order to ensure that these programs are well supported by sound research. Needle exchange programs offer the additional rehabilitative and medical services that we kind of discussed today, but we also talked about how people utilizing these programs are not required to utilize these services, so that could create a financial burden for taxpayers or organizations that choose to implement these. Another issue that we maybe didn't touch on as much is implementing these in communities. Not everyone might have equal access to them. So that's also something to consider, the different social determinants of health that might impede somebody's ability to even access the services that they might need. So while these programs are implemented to reduce the stigma that comes with intravenous drug use, there's still a lot of stigma that also exists within communities. So having that education to integrate these programs and ensure that people in the community have that buy-in as well will be important for moving forward. So needle exchange programs are a great harm reduction approach. However, the aspects I discussed today highlight the need for careful and intentional planning, careful or credible research, program considerations, equal access, community education, and community buy-in to ensure the success and sustainability of these programs across different contexts.
Okay.
All right. And that is all we had.
Thank you for listening to our debate.